Is the lumbar puncture necessary to diagnose multiple sclerosis? And the answer is not always necessary. In certain circumstances and situations, yes, the lumbar puncture might be necessary. Now, to diagnose multiple sclerosis or MS, we rely on the McDonald's criteria that initially was published in 1997 and then got updated later on. So with the McDonald's criteria, we rely on multiple things to make the diagnosis of multiple sclerosis, and one of them is the clinical presentation, or what we call the MS attack. Number two is the MRI finding and the white spots that we find on the MRI, and then number three, we might rely or use the lumbar puncture. So with the McDonald's criteria, we use the term disseminated in space and disseminated in time. So when we first look at the presentation, the clinical presentation for the patient. The patient presents with symptoms that are in an anatomical distribution that can represent MS, which could be numbness, tingling sensation of an extremity or half of the body. It could be weakness, it could be gait disturbance, it could be slurred speech. Those symptoms have to last for more than 24 hours for them to qualify as an attack. Now, when we talk about disseminated in space, that means the patient has another attack in a different anatomical distribution. So the first attack, the patient has numbness or tingling sensation or weakness in the left arm, and later on they have a weakness in the right leg. So that's disseminated in space. And that is considered another attack. And disseminated in time, the attacks must be separated for more than 30 days or a month. And that becomes two attacks if the patient has another attack a month later in a different anatomical distribution. Now, when we're talking about the MRI findings, we'll look at the white matter lesions on the MRI. They have to be the specific, or they have a specific pattern to them. So they have a shape, it's usually oval shape, size, and the distribution. And this distribution is important where in the brain they are located. And also with McDonald's criteria, we use the disseminated in time, disseminated in space term too. So disseminated in space, that means we have more than one lesion in different areas of the brain. And that is disseminated in space because it affects different parts of the body. And when we talk about disseminated in time, then you have, let's say we gave a contrast to the patient on an MRI. So you have one white matter lesion lights up, and that indicates that it is acute and it's an ongoing attack. And then you have what we call a black hole or an old white matter lesion. And that's used as disseminated in time. So with McDonald's criteria, if you have a patient who comes in with two attacks, clinical attacks, with two white lesions on the MRI, then that's usually confirms MS, and we don't need the lumbar puncture to confirm the diagnosis. However, in certain circumstances that we have, for instance, only clinical presentation similar to MS without any MRI lesions, we call clinically isolated MS. We spoke about it in a previous video. Or you have one MRI lesion with two attacks, one MRI lesion with one attack. All of those might require that we do a spinal tap. With the spinal tap, we look for something called oligoclonal bands, which we usually see them in about 85 to 95% of MS patients, and not in every MS patient. So if they are present, that might help us, and we might use it as part of to fulfill the criteria of multiple sclerosis. Also, we use the lumbar puncture when we suspect what we call MS mimickers. MS mimickers are certain diseases that can mimic MS and give the same symptoms or the same MRI picture, but not exactly like MS. So if we do an MRI and we find some white matter lesions, not very typical for MS, but they are present, so we might do a spinal tap to check for mimickers. Certain mimickers include connective tissue disease, rheumatologic disease, vasculitis, and other viral diseases that might mimic MS. In these circumstances, we might use the spinal tap to help us with the diagnosis. So the bottom line, that a lumbar puncture is not always necessary to confirm the diagnosis of MS, but in certain circumstances, we might use it to help us with the diagnosis. Thank you.